Good evening and welcome to another episode of Let's Talk Business. I am so happy to be back in the studio. I miss it so much. Happy New Year to everybody. Thank you once again for tuning in. And just remember, you can watch us on Facebook, YouTube, on Amazon Fire TV, and now on KGNG channel 26.8 TV in Las Vegas. You can also listen to us on our PHLV radio app or get our podcast on Apple Podcasts, Spotify, and iHeartRadio. What a fantastic start of the year, and of course, our show. We have a very special guest tonight, a very good friend of mine with a very cool vision for his business model. I am sure most of you have heard of Concierge Medicine. It is also known as concierge care, boutique medicine, or direct primary care. Basically, it's a membership-based healthcare that pairs exclusive personalized care with accessibility and convenience. The concierge concept is appealing for both primary care physician and their patients. Now, I'm sure you've also heard of aesthetics. It is a medical specialty that focuses on enhanced cosmetic appearance. This is achieved by doing procedures for different types of conditions such as melasma, sculpture, injectables, and even tattoo removal. My guest tonight had the vision to put the two together and create a wellness center that takes care of both aspects on one's wellness. So tonight's guest is a very good friend of mine, like I said. He completed his studies in internal medicine in St. Mary's Hospital, UCLA Medical School. He was chosen as the chief resident and subsequently joined the faculty of St. Mary's Hospital, UCLA Hospital, where he taught before moving to Las Vegas. He is a board-certified internal med. He was recognized as top 101 doctors in Las Vegas and currently serves as a member of the Medical Executive Committee for Summerlin Hospital and Medical Center. Everyone, please welcome my guest tonight, my good friend, Dr. Christopher Choi. Dr. Choi, how are you?
Great, thank you. Thanks for inviting me.
Of course.
Great to be here.
Of course. I love them.
Happy New Year.
Happy New Year. So happy that you're here.
Yes.
Anyway, so tell us a little bit about yourself. I mentioned a little background, but please tell us your journey from med school to deciding to come here to Vegas.
So I graduated medical school in 1996, and then I did my residency at St. Mary's, and then the chief residency, and stayed a very short time as a faculty at St. Mary's.
Okay.
And then I realized I'm not an academician. I'm a clinician.
Okay.
And I actually need to see patients. I thrive with that interaction with the patients.
Sure.
So that led me to Vegas, and that was in 2000, end of 2000.
Okay.
And I've been here since. And mainly I've been in Summerlin area, and my practice has been at Summerlin on campus there.
Okay.
And then eventually moved to Southwest. And as I was expanding, I needed more space.
Gotcha.
And just to correct, I was on the medical executive committee for about 14 years, and then just a few years ago, I actually stopped doing that.
Oh, okay. All right.
It's just not enough time in a day. So.
Well, you're a busy man.
Yes.
We all know that.
Yeah. So, I had a regular practice like everybody else.
Sure.
But even back in 2000, it was more of a concierge style, meaning I only took care of a handful of patients, and patients paid me every time they came to see me. But over the several years, I realized that the way I was practicing, if I didn't make it was a hard decision, but if I didn't make some sort of change, I was going to actually basically bankrupt.
Okay.
Because I couldn't bring in enough income the way I was practicing. So either I opened the floodgate and start accepting any and all insurances, and put a phone triage, press 1, press 2, and go to that model.
Okay.
Or officially convert to a retainer-based or concierge style of practice.
Yeah.
And so I opted to go in that direction, the concierge, instead of opening up the floodgate and taking care of like 2,000 patients.
Yeah.
So that's how I actually started concierge wellness and aesthetics in 2008.
In 2008.
So I've been doing the concierge style of medical service for about 15 years, over 14 years now.
Tell me, Dr. Choi, what is the biggest advantage of a concierge wellness center versus the traditional primary care where you take all the insurance?
Okay. So, just a little background. All the physicians, want to take care of their patients well.
Yes.
The problem is the time constraints, and when we have to take care of over 1,000 patients in our panel, it's like we have 15 minutes to see each patient.
Yeah.
And we have to see like 25 patients a day.
Okay.
To keep the clinic open.
Sure.
From financial standpoint. And that means that there's no time to actually set up. Long time ago, we used to leave a few openings throughout the day.
Yeah.
To accommodate patients who have urgent medical needs.
Sure.
But because the reimbursement is getting less and less, and we have to see more patients, there's no way for physicians in a traditional primary care practice to leave openings for urgent add-ons.
I see. Okay.
So with that, it became very difficult for patients to actually see their doctor in a traditional practice. And typically, if they call to make an appointment, they may have to wait several weeks to a month or so to actually see their doctor.
Yeah.
Or they may be able to see a mid-level practitioner. Or typically they're told, well, go to urgent care if you have an urgent issue. And patients don't like that.
No.
The care may be great, but the patients don't like that.
Sure.
With concierge style of practice, because we are taking care of just a fraction of those patients, with just a few hundred patients, we are actually able to see patients for half an hour at a time or even longer.
Yeah.
And we are able to accommodate patients the same day or by next day appointments.
Okay.
So that is the biggest the advantage.
Yeah.
And the fact that you are a patient in a small practice, so the physician actually knows you really well. And that's the big advantage. It's a very, very personalized care. It's like practicing like country doc old days, but with a new technology.
Okay.
That's really what it comes down to.
Yeah.
And each individual gets a very specialized personal attention from the physician and the staff.
On this model, does insurance even play a factor anymore? Are you able to can they still use their insurance, for example?
Oh, yes. And in fact, they should have I actually emphasize to my patients that they should have an insurance.
Okay.
What we provide as a concierge doctors, we're not insurance. We're not insurance company. So we're not an insurance provider. We provide a medical service. And they should have an insurance because if they need to get blood drawn or get a EKG, or if they need to get a CT scan, radiologic studies, or if they need to go see a specialist, and God forbid, knock on wood, if they end up in the hospital, they need insurance. Otherwise, it'll be very difficult.
That's a really big decision that you did. But of course, coming from a patient's view, I love the route that you take doing the concierge. You're right. I mean, like me, I see a regular provider and it takes me forever to get an appointment. Sometimes a month or 2 months. Yeah. And it drives me nuts because sometimes I'm out of medicine and they won't prescribe until they see me. But I'm like, it's a month away. It's crazy.
So, exactly. So we do a lot of things over the phone too.
Okay.
Yeah. So, because we got plenty of time throughout the day, I can actually call my patients. If there's a lab that we drew like a few days ago, I don't need to have the patient come in. I can actually go over the lab results over the phone for simple things. And if my patients have a little sniffle, I can actually triage and take care of them over the phone. So we have plenty of time to actually do that. So because we're only taking care of like 300-400 patients, we have plenty of time to call the patients during the day. And, so that makes it it makes it very, very satisfying for me as a physician, but also it's satisfying for our patients.
The two things that people always tell me, the most important things for them, of course, is their money and health.
Right.
So when you're health and you have a doctor that's really invested in it, that knows you, there's consistency, it makes a big difference.
And some other benefits are, because we're taking care of just a few hundred patients, we have ample time that we can actually do a very, very thorough physical exam every year. So, in the membership, most concierge practices will include some form of a executive physical. And in my clinic, it usually takes 2 visits because it takes about almost 3 hours to do our physical. So we do that every year.
Let me ask you this one. What are some of the trends in medicine that you're seeing that you might see here in Vegas in the future?
Trends. So right now, more than ever, people are interested in longevity.
Okay.
People are interested in longevity. So wellness, staying healthy, and perhaps trying to, lengthen our life expectancy. And being healthy, whether we live 80 years or 90 years or 100 years.
Yeah.
But I think we all would like to live 100 years if we can.
Yeah.
As long as we can actually stay healthy.
Of course.
So the trend is anti-aging.
Okay.
I'm not talking about, when we think about anti-aging, we talk about aesthetics on the outside.
Yeah.
We're not talking about looking young. We're talking about inside,
Okay.
being more healthy and living longer, anti-aging. So,
It's funny you say that because I can't remember who I was talking to yesterday, but even fast foods now are coming up with like tofu burger or some kind of alternative healthy burger or chicken
right, yeah,
their food. So you're right. It is really becoming a big trend. So
I mean, it's because a lot of things start with a diet, right?
Yeah.
Lifestyle. So we're always nagging our patients about lifestyle. Change your diet, exercise, and so on, and try to eat things that are organic.
Well, you know what? I'm guilty. I'm one of those. Okay. Well, I do want to talk more about your aesthetic side. So we're going to do that. We're going to do a quick break. When we come back, we're going to talk about your aesthetic side. Is that good?
Yeah, sure.
All right. We'll be right back.
This is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio.
Welcome back. All right, we are talking to Dr. Choi of the Wellness Concierge Center. Dr. Choi, I want to talk about the aesthetics part of your clinic, but any final thoughts on the concierge?
Yes, just a couple of things. I talked about some of the advantages of concierge medicine, but the biggest thing is that you get to have a personal relationship with your physician and the staff.
Yeah.
So, coming to doctor's office is worrisome for patients, nerve-wracking, because, you typically don't expect the good news when you come to doctors, right?
Yeah.
So if you come to a office where you know everybody and where everybody knows you, it does make it a little more personable and makes it a little less anxious. With the concierge medicine, you are going to actually get a beautiful physical exam every year.
Yeah.
You're going to have a physician who's going to be available 24/7. So actually, in all concierge practices, you do get the physician's cell phone number.
Okay.
And so in after hours, they can actually call the physician if there's an emergency, that they cannot wait till the next day. And your medications are typically filled the same day, and you're offered the same day or the next day visit. And if you're in a crunch for time, then we can always take care of you over the phone.
Okay.
So those are all of the benefits. And the primary care physician's job isn't just to treat the patient, but we're also supposed to coordinate their care. Coordination of care typically means you have to actually find a specialist and try to actually make the referrals and so on. That's the bulk of the coordination of care.
Gotcha. Okay. Yeah.
And we go a little bit above and beyond than regular clinic in the concierge. We may in fact actually call the specialist office and try to expedite the process and so on. So those are all of the benefits. Unfortunately, which means it does require a membership.
Okay.
So that's the drawback.
Sure.
But typically the membership is actually affordable. It's not crazy amount. Like it's not like a $10,000-$20,000 a year.
Yeah.
So it is actually affordable
Okay.
for average folks.
Yeah. Well, when you think about it, we're talking about our health.
Yes.
And we spend so many different things on crazy things sometimes. We always make sure that we get the best care possible.
Correct.
And by the way, you're right. And my brother thanks you very much. You've sent patients to him.
Well, he's a good specialist.
Yeah. So thank you for that.
Well,
No, it's truly it's a great model. I'm a believer in it, and just for the audience, Dr. Choi's staff is wonderful. My wife loves coming to his office. Anyway, all right, let's talk about your aesthetics because I'm really excited about this part too. What made you add the aesthetic side, and how does it complement wellness?
Well, over the years, a lot of my patients were asking, "Well, Dr. Choi, can't you just do the aesthetics in your office? I'm talking about non-surgical aesthetics, so the lasers, the microneedling, radio frequency, and so on.
Yeah.
They're asking, well, can't you do this in your office? Because we don't want to go to other places.
Yeah, they're comfortable with you.
Yeah, so one-stop shopping.
Yeah.
So I just kind of, it was in the back of my mind for a number of years.
Okay.
And about 4 years ago, I felt that, what, the time is right. So we actually start adding. And it just kind of grew, and people are asking for more.
Yeah.
So I just kept on adding more devices and more technologies. And so as of right now, what we have, we can basically do anything anybody else does in any other aesthetic clinics.
Nice. Now, it has really become such a big part of taking care of yourself. I mean, in the past, people think just aesthetics is just looks, but no, it's more than that. Can you tell us the benefits of coming to an aesthetic center such as yours? Yeah.
Okay, so you hit the nail on the head. Aesthetics is a important thing in my mind, in my opinion, because the skin is the largest organ system in the human body.
Yeah.
And so taking care of our skin is a big part of our wellness.
Wow,
and
I never thought about it that way. That's pretty good.
And how we feel on the outside has a tremendous effect on our inner well-being. So we do need to look good.
Okay.
And especially after the pandemic.
Yeah.
During the pandemic, so many of us are spending so much more time online and looking at our own face.
Yeah.
And now it's gotten very, very popular. People want to look better because they've seen those little pores, little brown spots. We are our own, worst critic, right?
Yeah.
So we like to get that better. So that's why people are actually wanting to do more and more aesthetics. And
well, that makes sense.
yeah. And in my clinic, I think we provide a unique experience because it's a physician-driven, and our staff are obviously specially trained for all of the equipments.
Yeah.
And so patients are pampered. The minute they walk in, our staff does everything we can to actually make the experience a unique experience for the patient. Yeah.
All right, I got to ask you. So, well, first, before I ask you this question, Dr. Choi has this really cool machine that makes you feel like you did push-ups. I tried it myself. It was fantastic. So, but what are the most popular procedures? Just can you give us example and describe to us what it does and what's the benefit of it? Yeah.
Right. I have multiple different equipments, but in my clinic, the most popular device is PicoShare Pro.
Okay.
It's a picosecond laser. It is a laser, but it's a picosecond laser, very unique.
Okay.
Because it is a picosecond laser, it actually does not create a lot of heat.
Okay.
The typical laser creates a lot of heat, and the heat is our enemy in some ways.
Okay.
So, like for people of color, Asians, Hispanics, African Americans.
Yeah.
Because we have a lot more melanocytes and Caucasians.
Uh-huh.
If we hit our skin with too much energy, too much heat,
Yeah.
then we can actually create brown spots.
Ooh,
We can
okay.
hyperpigment. So picosecond lasers are great because it does not create a lot of heat. It actually uses a kind of the mechanical,
Gotcha.
mechanical trauma with a laser.
Okay.
To actually break up the pigmentation. So picosecond laser is my most popular device in our clinic, and it is used for melasma. And in fact, the PicoSure Pro, which is brand new from September of last year, is the only device that is actually FDA cleared for treating melasma.
Oh,
So
okay.
it's great for melasma. It's great for other pigmentations like the lentiginous brown spots,
Yeah.
sun damages,
Yeah.
and also it is also FDA cleared for treating some of the some of the birthmarks.
Birthmarks.
Birthmarks, and also it is probably the best device out there for removing tattoo.
Tattoo. Oh, really?
Yes.
Okay. Hey, I didn't know that even. Well, of course, men can have it too, but I didn't know that melasma was common for men too.
Yeah, but it is, but it is actually a lot more common for women.
Okay. Yeah.
Because it is a hormonally driven.
Okay.
So it is after they have the baby.
Yeah.
It's they call it the mask of pregnancy.
I
So
see.
it comes out.
Okay.
And
gotcha.
sun makes it come out. So
I see. Okay.
There's a word of advice: wear your sunscreen, wear your sunscreen, and reapply them every 3 hours if you're outside. Right? So that device also does acne scars. It's
Okay.
great for acne scars. Yeah.
So anything new coming up? Anything in the future for the concierge or the wellness?
I mean, we've just launched a couple of new devices.
Okay.
Especially the one called M-Base.
Okay.
It's a very interesting device. We call it the non-surgical facelift because it will actually stimulate the same muscles that we actually tighten during with a plastic surgery. So zygomaticus major muscle in the cheek. So it will tighten that, it will lift. So it actually really does give it a facelift look. So
Okay.
lift that and
Yeah.
up here. So that's a brand new device from BTL. It's called
Nice.
M-Base. So they just launched it in October, and we've launched it in November.
Okay.
And we're the only place that actually has it in the city of Las Vegas. So there are only 2 devices, including Henderson. There's one person who has it, and we're the only one in
Fantastic.
Vegas. So
Nice.
it's actually very safe. There's no downtime.
Okay.
It's very unique because it actually lifts the muscles, tightens the muscles without taking a knife to the face.
Gotcha. Okay.
And then something else that I want to talk about that is actually very interesting
Sure.
is you mentioned that device that we have to mimic the crunches.
Yes.
So it's the 20,000. It's equivalent to doing 20,000 sit-ups in 30 minutes.
Okay.
So it really strengthens the muscles. And I bought the device for aesthetics, for body sculpting, getting rid of the fat.
Yeah.
Because it does decrease the fat by 30% in the abdomen.
Okay.
And increase the muscle mass by 25%. So I bought it for body sculpting, and gym rats love it
Yeah.
because it's really hard to get 6-packs.
Yeah.
And with that device, you can actually get 6-packs. But we've been using it for medical purposes, rehab.
Okay.
And it's working out really well. So it's not just me. So I've gone to conferences where we're talking about this device,
Yeah.
M-Sculpt Neo, and other physicians have run clinical trials treating patients with back pains, chronic back pains, and with tremendous results.
No
And,
kidding. Okay.
Yeah, I mean, it makes sense because you need to strengthen the core.
Yeah.
And that's exactly what this device does. So
Okay.
it really strengthens the core. I mean, really, really strengthens the core. So I've been using it for my patients with a chronic back pain.
Okay.
In fact, I've actually treated some of my patients without charging them because
Okay.
I wanted to see, and it really does work. So
Okay.
they are reporting that their back pain is like 70-80% better.
Okay.
So it's got medical uses, and we
How
are
about
actually
that,
doing
huh?
clinical trials with patients with strokes.
Okay.
And there's a clinical trial that's studying treating patients with Bell's palsy.
Okay.
So I think we're going to start using these devices more for rehabs also.
Also, that's
in the
fantastic.
near
See, you
future.
got dual purpose.
Yeah.
Okay, this is great. Now, I want to ask you something a little bit more healthcare related, so if that's okay.
Yes.
Here, especially here in Nevada, what do you think are some of the biggest challenges in the healthcare industry?
You know, Las Vegas has been growing so fast.
Yeah.
We're not able to keep up with a number of healthcare providers.
Okay.
That is the biggest challenge I see. And 22 years ago when I came, we said, we didn't have enough physicians here. And that deficit has gotten bigger and bigger because over the years.
So we weren't able to catch up. It actually got worse.
Correct.
Yeah.
And we are, if I remember correctly, we're like the 48th with 50 states, 48th to 49th in physician deficits.
Oh my God.
So it is really bad. And we are trying. We've actually come up with a number of residency programs with the idea that hopefully we can train those physicians and they'll stay. So we are getting more physicians to stay, but still we have a huge deficit in a number of physicians, and I think this needs to be resolved at the state level and with the legislatures. We need to make it more favorable for physicians or healthcare workers, nurses. We have a huge shortage of nurses too.
Yes.
So we need to make it more attractive for physicians and nurses, physical therapists, and so on, for them to actually come to Vegas and stay.
Good. That makes sense to me.
Yeah.
Thank you so much.
Thank you for having me.
Before we end, please tell the audience, where is Concierge Wellness and how can they contact you?
So we are located at 4035 South El Capitan Way, Las Vegas, Nevada, 89147. We're off of 215 and near West Flamingo. So phone number is 702-463-8080. And our our website is www.cwclb.com, and our Instagram is at cwclb. I'm sorry, it's at cwc.lb.
All right.
Yeah.
Dr. Choi, wonderful having you tonight here. Thank you so much again for coming in. For my audience, it's really a great wellness center. You've got to visit it to see exactly what we're talking about, and if you contact him and take a look at the machines that he's got and see what suits you. And then last announcement, we're going to be announcing soon some of the free classes that the NBA API Chamber is going to be providing for the small businesses that would like to try to get into the Super Bowl for next year. So please stay tuned for the coming dates for those free classes. The classes will be on making sure you're certified, or what kind of requirements you need to have to be able to apply for them, capability statements, and good things like that. All right, that is our show for tonight. Good evening again, and thank you for tuning in. I'll see you next week.